this tapping communicates in the vertebra, and the vibration release all the tension, and then it's looser. When I can do my manual technique, it will realign. So we have this situation in this guy since he was 8, and all the scoliosis, all type of scoliosis, they begin in childhood, from 8 to 16, when the body has the spur to grow up. I do the analogy of a tree planted into a room, and when it reach the ceiling, it cannot go further, so it will bend. In this guy, he already has 2 sessions, and we got rid of the pain. The first things that they come for help, it's pain. Here we can see the tilt in the pelvis. The spine goes this way, and then goes this way, and then goes this way. This is his spine. I want to show also the condition of the shoulder. You see, this one is shorter, this one is larger. You can, okay, like this. And also all the position of the ribs. Here the ribs cage is inward, and here is outward. They create like a bump. So that's a clear manifestation of rotation in the vertebra. And rotation in the vertebra, they create a rotation in the rib. And also the whole structure. You can see the position of the legs and the position of the arms, and everything is a compensation. So the body tries to compensate this disharmony here. But for my understanding, it's never a situation, a physical situation. It's always a physical and emotional situation. For me, it's more emotional. It starts with the emotion, and the person cannot express, then adapt to the environment, and then create all this. So now I want to check the ribs. We can see the chest here. This is down and this is up. This is more up, this is down. This is wide, this is thinner. So we can see the position of the ribs reflect the position of the spine. So when the spine is going one way, it becomes larger here. So in order to adjust the scoliosis, we need to work all the frame. We need to work all the thoracic chest for the curve in the thoracic chest. And if you check the lower here, okay, you can see this misalignment here. So this is the curve on the lumbar. So there is two work, one like this and one the opposite, a compensation. So it's a work of readjusting not just the spine, but all the body, all the structure of the body. Now we're going to see the movement of the joint. So because the joint, the hip and the shoulder, they will express the misalignment. So you just lie down, and then we can see the position here. And we look at this movement here. Okay, this and this, completely out of alignment. So we have 2 movements, this and this. This is not because of the legs, it's because the position of the pelvis. Okay, so I'm trying to realign the pelvis my traditional way, and then I do the tapping. Okay, so, okay, relax. Now you see it's already aligned. So now I can start tapping the lumbar area to mobilize and realign the vertebra in this area. So I'm going to tap L5S1, and the sacroiliac joint, which run into the sacrum here. This alone will take out all the pain in the lower area and create a stable base for the work that I'm going to do upward. Communicate into the bones and bypass the defense mechanism. It's very comfortable to receive, and it's painless. So the brain will unlock. The brain will unlock all. This is defense mechanism. This is an adaptation of the situation, the emotional situation that he had. And now we are going to work bypassing that. The thing is, to make the work stable and permanent, you need to change the way you perceive the reality. Otherwise, it's going to go back like this. There is dynamic hypnosis. We can work on this and have a transformation. So now I'm going to work the spine in the curve to release the muscle tension. And then in the other side. Here it's another. This is a critical point for him. There's two critical points where really curve here like this. You cannot see it. This tapping communicates in the vertebra, and the vibration releases all the tension, all the fascia tension and ligament tension. And then it's looser. When I can do my manual techniques, it will realign. I need to unlock all the spine and all the rib in the front and in the lateral. For the serratus anterior here is pretty tight, and in the front, in the sternum. Relax. It's very important to unlock the ribs. So the sternum, the manubrium up here, the clavicle, and all these joints in the sternum. And there is another joint in the middle of the ribs. And then unlock the serratum, the muscle serratum that is pretty tight. So this will allow the vertebra to loosen up and will allow their realignment. Okay, this tapping is very fast in releasing all the tension because the vibration, the body feels the vibration, gets into the nerve, communicate with the nervous system, and unlock the defense mechanism, the fight or flight response, and it put the body into repair mode. Scoliosis is the most challenging intervention that we can have. But for example, a frozen shoulder can be unlocked in just one session, or a sciatica, or whatever. It's very, very fast. Also, we need to unlock the diaphragm and the psoas. They communicate together. So we need to go down deep, release the psoas. That will release the diaphragm, and all these muscles are attached into the spine. The psoas is attached from T12 to L4, and the diaphragm is attached to the thoracic vertebra. So scoliosis is not just scoliosis. It's a situation in all the body. Mm-hmm. Okay, after the session, this is the result. The session was 20-minute one. Usually a session is 3 hours. So we go thoroughly over the whole body, and then there are a lot of manual techniques. But I can see improvement compared to before.